Welcome to Sex Care is Self-Care, a conversation on women's sexual health brought to you by the Patty Brisbane Foundation for Women's Sexual Health. I'm your host, Patty Brisbane. As your older children become more aware and curious about sex, many parents wonder what the most important topics are to discuss and approach that they should take in doing so. Dr. Christine Vaccaro and Dr. Cheryl Iglesia are here to help navigate this crucial conversation with your teenager. Dr. Iglesia, how can you depict sexuality as healthy, normal, and an important part of being human when starting the conversation with the teenager?
I love talking about sex with teens and tweens and just talking about everything being perfectly normal. And so I think puberty is like ideal because now you're just really seeing the effects of hormones and changes on physiology and anatomy. And, you know, it's just a way that you can talk first about breast buds and how, you know, that's like the first sign of thelarchy, the first sign of puberty. And we're going to get a bra, you know, because that's what we do when we start to get these breast buds. And then like adrenarche, that's the next phase of puberty. And that's when, you know, you start to grow hair and, you know, there may be some friends like, you know, I remember my daughter had someone, she was, Kayla had so much hair down there, Mom. I said, yeah, I know people are the same age, but you know, there's different levels of the hormones, which are like the testosterones and the androgen ones, which cause you to have hair and they give you body odor. So we're going to be talking about the pubic hair. We'll be talking about the need to shave your legs, and underarm deodorants, because this is what's happening with adrenarche in girls, and we can talk about it in boys as well, and the need to shave your face and wear deodorant and whatnot. And then you get that growth spurt. And with that growth spurt and the changing of the voice, and then that's usually the signal. Once you get that, typically, if we're following the phases of puberty, that the next phase will be menstruation, and that will be another conversation about how we handle periods. What the signals are, what's normal bleeding, because sometimes periods can be a sign that you actually do have some abnormal bleeding, clotting things, and you doesn't come up to start having your periods, and that's not normal. You talk about products, pads, and tampons, and Diva cups, and how to use those in a healthy fashion, i.e. not leaving them in for 24 hours for the risk for toxic shock. But all of this, including erections and masturbations in boys, it's a fantastic topic because basically you have a huge physiology lab going on. And when you tie it all together, as I said before in the other one, with the hypothalamic pituitary ovarian and testicular axis, it becomes really interesting. And so just to find out what to expect, you know, normally, you know, this process starts between like 9 to 11. And the average age, I think, for periods right now in America is about 12, although I think actually it's going down a little bit. And in girls, I think this is a perfect opportunity to then talk about sex. And I think Dr. Vaccaro can take it after that, but this is a key opportunity to provide our children and tweens and teens with accurate information lifelong that they're going to need.
There you go. Dr. Vaccaro, some kids, they mature faster than others do. So how do we tailor these conversations based on where they're at?
It takes a lot of astute parenting, I'll be honest, because there's every child is different, and their emotional and developmental needs are going to be different. And there's two types of maturity, right? There's their physical changes, and then there's their mental maturity. And usually they go hand in hand, but not always. So the physical maturity, like Dr. Iglesia was pointing out, it all has to do with puberty and hormones and changes. So, you have, most of these are pretty obvious, usually again, starting with hair growth under the arms and the pubic area, acne and breast development for girls, needing to wear bras, things like this. And the onset of these changes for girls can be as early as 8 years old. And for boys usually starts around 9 to 10. So just being really aware of all these physical changes, and like just echoing what Dr. Iglesia said, taking the opportunity when these changes start occurring to open the door to discuss what body changes mean, how this makes you develop into an adult, which is then capable of reproduction, and not even as an adult, right? Teens obviously get pregnant too. So just kind of opening the door to discuss what it means. For mental maturity, during puberty, adolescents have all these new thoughts and feelings because of the new hormones that are circulating in their brains. And again, this is just what it's all doing, is you're preparing them for adulthood, preparing them for potentially being a parent one day, or if they don't want to do parenthood, just having a healthy sexual life. Girls tend to have a more mature brain development earlier than boys, and part of this is the delay in the different ages and maturity of puberty for the different genders. So you do kind of have to tailor and adjust a little bit based on gender and when normally they start making these changes. So again, it's just important as a parent to just watch closely and carefully for signs that your child has become more developed. Watch for things that they start doing, like the clothes they wear, the friends they associate with, the shows that they like, where they spend their social media, all these things kind of, if they're now getting into the shows that are all about relationships and things, they're probably maturing towards wanting that themselves, and they're looking for more information about what that looks like. So just kind of keeping the whole picture on your child, and certainly again, like we discussed in a prior podcast about when to start talking to your child as young as 4. So don't wait. You don't have to wait for puberty to start opening the door. Again, the more frequent it's discussed, the more normal it is, and the more they're going to feel trust in you to have that open door conversation. So it's not just an age appropriate, it's a child specific discussion regarding the content you share with your child. And just as a one other thing that I wanted to mention that Dr. Iglesia said, for girls, menstruation is really a scary time. If you don't talk about it with your child, and again, it's been reported as early, sometimes it's 8 years old for, that's certainly on the very lowest end, but it can happen that early. It's unusual, but just making sure that you've had the conversation, because some girls, if you don't tell them, they could think, they're going to die, something's terribly wrong. Usually bleeding is a sign of something very alarming.
Yeah.
So if you don't tell them that this is a normal bodily function, they might be very, very terrified. Personal note, my daughter is 12 and she's not yet menstruated, but she has all the supplies in her bag every day, just in case. She knows what to do. She's prepared. So she doesn't hopefully have a very awkward and potentially humiliating experience at school, that even though it's normal, still children aren't completely mature yet in middle school. So trying to prevent that, it is also something that I think parents should strive for.
It is important, to get that child prepared, because it could happen at school. It can happen anywhere. And, you might not be there. And so they know how to take care of themselves at that time and not be frightened because they found blood in their panties. So, yes, having that conversation is important. Okay, Dr. Iglesia, yeah. Can you talk about how important it is, I love this, about being shocked, not being shocked by anything that your child may come to you with questions? Because the poker face, remember we talked about the poker face?
Patty, you probably have a better poker face than me. Look at me. I'm like, the only thing that's going to help us in this pandemic is the fact that we have our masks on. So it's probably easier for us to have with those N95s and goggles to hide the poker face. That is the key thing. The key thing, and I just remember the book, and I read it maybe even a couple of days, How to Talk So Your Kids Will Listen and Listen So Your Kids Will Talk, is that you have to like not be shocked. So that opens the door because you want to try and understand what they were told, and then in a culturally appropriate and obviously age appropriate maturity level, say, okay, that's interesting, but that's not quite accurate. And so this is what you're talking about when you're talking the business, and this is what you're talking about when you're talking about the girl's butt, but the problem is that business shouldn't be going into any place right now, whether it be the butt or the vagina or the mouth. And it's just, I feel like, again, it has to go back to the education of the anatomy and all of that misinformation. You don't want to just diss it and just say, oh, he's wrong, or read this book or that. Literally explore, because there are probably other things that they've heard on the school bus, or they've seen at other kids' houses, or they've seen online. So I think that is an important thing to just tell me more about it. I'd like to hear, what are your thoughts about it? Or the beautiful question, how did that make you feel?
Yes.
Those kinds of open-ended questions, all of which are in all the therapists will tell you, and books like How to Talk, being more empathetic in your listening and discussing. Again, I mean, we talked about this on the last podcast, trying to react without really judging, and just more of a listening of interest. Like, I'm really interested. Tell me more.
I think when they so curious. Sorry, Patty. Sorry.
No.
I was just going to say, I love the curious factor, right? If you come from a position of pure curiosity with your children, like how and why and tell me, and you have that literally that stance of curiosity, it does, I think, open some doors for them to share, because you aren't judging, you're not, you literally want to just know why. And I heard a pediatric endocrinologist, when she was talking to our fellows about different gender identities and sexual orientation, to talk about it like you're ordering a hamburger. Like, try to just not get all alarmed or look shocked, but just try to be as plain and matter of fact as if you were just taking an order for food, to just take it down a notch.
Yeah, because I think there would be some parents that would start off with, why were you talking about that?
Yeah.
What was happening before you started talking about that? And I think that's when the child
shuts off.
Yes. And cannot have that conversation. And if you forget how that conversation came up, they're going to tell you, but you've got to be calm, and you've got to listen to them. And you're right. And you've got to show that poker face.
But there's also that whole punting where I was like, go talk to your dad, or like, go talk to your mom. Or like, okay, go talk to your Aunt Jenny about this. I suspect if you do feel super uncomfortable and is totally shocked, maybe that is appropriate sometime to have another person or talk to a professional and say, oh, we're going to, talk to someone who can give you the language. Because I do think that, you said that if you weren't an OBGYN, you said you didn't really hear a lot about this till you were 18, Christine. I think that's not uncommon. So, you're passing on generational knowledge and probably some generational trauma, right, on this. Mm-hmm. And so getting professional help is not, there's no shame on that either.
Dr. Vaccaro, what are some of the tips that can be helpful when talking to your teenagers about sex?
I love this. And I'm going to ramble for a little bit here because I think there's
Okay.
so many topics here. So I think number one, most important is if you haven't had the conversation, make it a priority today. I think we've hammered on it a little bit, but I think that's the most important. And like Dr. Iglesia said, if you feel very uncomfortable and you just can't do it yourself, find someone you trust to have the conversation. I actually just had a close friend call me because she didn't quite feel comfortable talking to her daughter who's going through puberty and wanted me to give the talk with her listening and her daughter listening. And I think that's perfectly appropriate too. As long as you are facilitating the discussion for your child, and hopefully over time you get the comfort as well. Number two, consent, 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 consent. So I really encourage our listeners. I love this YouTube video. It's free. It's called "Can I Wear Your Hat?" And I mentioned it, I think, once before on a podcast, but it's great for teens. It basically outlines how to have a conversation about sexual consent with a simple analogy about borrowing a hat. And it's only like 2 minutes long. So for the short attention span that we all have, and the TikToks that are like 10 seconds long, it fits the bill of making sure that you get the point across about the importance of consent. And it also segues into safe sex because they use an analogy about a plastic shower cap, which is analogous to a condom. So it's really cute. It's really completely age appropriate, I think, even for younger kids. And certainly, I always encourage parents to look at content first before sharing with your child to make sure you feel it's appropriate. But what your teen needs to know about consent is, an agreement to kiss and caress each other doesn't mean there's an agreement to do anything further. So, if you open the door for one thing, it doesn't mean everything's on the table to be taken. So they need to know that if they feel uncomfortable progressing any further, that they need to say that they're uncomfortable and to stop. They need to know, especially for girls, that wearing something tight-fitting or a short skirt isn't an invitation for sexual content. And I think this has been discussed pretty widely these days about, women that have been shamed, that it was their fault, that, an unwanted sexual contact occurred because of how they were dressed, et cetera. There's also cute videos that are out there about that as well. But so making sure they know that based on what they wear, it doesn't invite the sexual contact. And just because you shared a kiss or held their hand or caressed yesterday doesn't mean that it's okay today. So every instance requires new consent, and it needs to be verbal. Next is for teens, then we know that this happens, mixing alcohol and drugs. So it's important to inform your kids that legal consent cannot happen if one of the parties are under the influence. This can even lead to criminal charges, even if they're under 18. And even if, and it's usually the girl, even if the girl is inviting or verbalizing that she wants sexual contact, but she's under the influence, that still is considered sexual assault if pursued. And we'll get into the digital realm a little bit later, but it's critical also to discuss consent when there's any form of, sexually explicit photos or recording. And of course, at this age, this would be strongly, strongly discouraged. Pretty much don't ever do it at this age. And really, I would advise that for adults as well for various reasons, but just make sure that, because digital information is so easily shareable, and you think you trust someone and you send something and then all of a sudden it's everywhere, and it can be very damaging, and cyberbullying, so many things that it can lead to. The consent, I think, is one of the biggest things to talk to teens about. So again, consent, 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 consent. I can't say it enough. And then the next is, of course, what I was taught about sex ed, okay, which was if you have sex, you're most definitely going to get pregnant, and you're probably going to get HIV, and then you're going to die. That was my sex education. Growing up, that I recall, I was terrified of sex, which is probably I won't digress, but, so make sure that even though we can be sex positive and I'm sex positive with my kids, and you want to discuss it as an important and vital and wonderful part of life, sometimes they say it's like sitting next to a cozy, warm fire. It feels really good. It feels good on your skin. It makes you feel warm inside. But if that fire gets out of hand and burns your house down, fires can be bad too. So, right. So sex and fires, you can use a similar analogy to let them know that there are consequences to your actions. And if you leave a fire unattended and a spark gets loose, the whole house burns down. So sex can have long-lasting implications, sexually transmitted diseases, and pregnancy, which I sometimes refer to as another sexually transmitted disease. That it's another process that is not as easily treated and can have more long-lasting implications. But making sure that you talk to them about safe sex and ways to prevent pregnancy if you haven't already had that discussion. So I'll defer to Dr. Iglesia about pregnancy and sexually transmitted infections.
So speaking of which, Dr. Iglesia, how do we talk to our kids about the prevention of pregnancy and STIs? There's so many girls that believe that it's not going to happen to them, you know, if they have sex a certain way, if they have oral, and I have granddaughters that come to me with everything. And speaking of which, so many, when they were in high school, I remember them coming and going, oh, so-and-so I'm not going to say what they said because it would be bad, but she sent in naked pictures to her boyfriend and I got them and I tried to tell her. And I'm like, where is it that a parent is not talking to their child about sending these pictures? Because if these other people are getting them, these other kids are getting them. I just felt horrible that nobody had a conversation with some of these little girls. Anyway, go ahead.
I'll come up on the sexting, but let's just talk about contraception and prevention of STIs. And I want to say there are well-educated people that still don't, Ivy League trained and stuff, who still don't understand this. I had a lawyer who ended up with gonorrhea in the throat. And, she knew that she wasn't going to get pregnant. She's having sex, didn't use a condom, didn't realize that you can get sexually transmitted infections in other areas of your body. So I think this is an important public health discussion. And let's talk about STIs first, so sexually transmitted infections. And there are a host of them. And, one of the ones I want to talk about first is probably HPV, human papillomavirus. And I feel like this has been a little bit politicized in some sense because most boys and girls are recommended to get the HPV vaccine even as early as age 9 to 11. So a lot of people don't want to give them a vaccine that has a 99% chance of preventing cervical cancer and rectal cancers and squamous cell cancers of the throat, because you can still get HPV in the throat and then lead to head and neck cancers. You can relieve that because they tie the HPV vaccine with having sex. So let's separate that out and just say that's a separate thing as a public health announcement. And if we can do something to prevent the debilitating effects that head and neck cancers that come from certain strains, high-risk strains of HPV, which are generally obtained through sex, anal cancer, and cervical cancer, that's a big deal. So the issue is no glove, no love. If you are not in a mutually monogamous relationship, and I'm not talking about trying to prevent getting pregnant right now, I'm just talking about preventing HPV, HIV, which is human immunodeficiency virus, which, the AIDS crisis, HSV, which is herpes simplex virus, and then all the other things that cause drips and discharges and can potentially lead to infertility, gonorrhea, chlamydia, leading to pelvic inflammatory disease. That this is important. So it is important that even if you're on contraception and you're doing all you can to prevent getting pregnant, you still want to prevent getting these sexually transmitted infections. And so the way to do it is with condom use. And so there are condoms that are made for men and latex, etc. And generally they have a nonoxynol 9, some spermicide with it. And then there are even female condoms. The condoms are great for HPV, gonorrhea, chlamydia. Not so great for the HSV because that's can cause touch. So generally speaking, HSV, herpes, if there is a lesion on the vulva, vagina, anus, even cold sores, and someone's going down there, or a lesion, an ulcer on the penis, you might want to just refrain because that is, highly transmissible when you have these ulcers that are shedding viruses. So, and even condoms may not prevent that. So that's important. But now in terms of contraception, so, this patient had an IUD. She just thought, oh, I'm not going to get pregnant and stuff, but didn't think about wearing a condom, and then got the gonorrhea of the throat. So the contraception is something that, unfortunately, we only have methods for women, except for condoms in men, which are barriers. Women generally need to, if they're not planning on having a family, use some form of contraception. And there are some great websites that are out there that have really good information, not inaccurate information. One is like bedsider.org, and the frequently asked questions on the ACOG, American College of OBGYN site, talks about the effectiveness of the different methods, because the barrier methods like the condoms and diaphragms and stuff are not that effective compared to hormonal contraceptions and IUDs and other long-acting reversible forms of contraception. It is important that patients understand that, once you get your menses and eggs are being released, that is a possibility that you can get pregnant. And it also happens when people are thinking that they're perimenopausal and all coast is clear. If you're still releasing an egg, it can still happen. But the bottom line is, I think that people don't understand this concept of contraception and sexually transmitted infection. While it's true, they can be very much related.
Cheryl, I love all your points there. And Patty, if you don't mind, I think one of our other board members recommended this Netflix it's actually not a documentary, it's a series called Sex Education. And I highly recommend it because if you don't think your teens are engaging in sex, you need to watch this show because it's everywhere. And if you don't discuss birth control with them, and thinking they're going to be abstinent, you're putting them at risk. Because
they think they're not going to get pregnant, so they'll do a blowjob or a hand job.
Right.
And
yes,
you can still get diseases from that.
Absolutely. But on the birth control, I think it's super important that it's not just the responsibility of the woman. So for me and my son, there's also responsibility too for boys, right? So if they are impregnating a woman, it's also their responsibility. So I like to teach both my children that it's important on both sides of the aisle because it takes two to tango, so to speak. But I love the long-acting reversible contraceptive methods. They're highly effective. They have extremely low failure rate for pregnancy, and they have high compliance rates. And I have lots of friends that have kids that are now needing this conversation, and kind of they feel a little awkward putting their kids on birth control in their teen years, but there's so many other benefits, I think, too, to hormonal birth control. So the treatment of acne is one. So if parents are feeling a little strange putting their kids on birth control, there's so many other beneficial effects of their body image by reducing acne. So again, the pill, the patch, the ring are also great options for prevention of pregnancy, but also improving the body image. Of course, they do nothing for prevention of sexually transmitted diseases, but every little bit helps if you're trying to get one step closer to protecting your child, male or female, against a pregnancy event.
Right. I think having those conversations are so important. And you, Dr. Iglesia, is the one that told us to watch Sex Education.
Thank you.
And I remember the very first time I turned it on, I'm like, oh my God. And then I believe that every single parent should watch this, because our kids have so many questions that are unanswered, and they're struggling, and they're going to their peers, to find out what's right or what's wrong. And I think if parents were more open and had these and felt comfortable and talked to their children, there wouldn't be all of that. But so I would highly recommend turn on Sex Education. It's in the beginning, it's a little bit difficult to get there, but once you do, you're hooked. I cannot wait till I think it's the third season I'm waiting for, because I feel like I learned something new every single time I watch that. So thank you. Thank you.
Yes. Thanks, Dr. Iglesia.
Okay. So Dr. Vaccaro, can you discuss how to talk about social media, pornography, sexting, and the importance surrounding it?
Gosh, Patty, this is so difficult for, I think, anyone that didn't grow up with all this at their fingertips, right? So our generation, speaking of anyone basically 30 and above, just didn't grow up with having all this information at their fingertips. And I think it's challenging for parents to understand all the implications, but this is so vitally important because 3/4 of adolescents are on a social networking site, and more than 80% have a cell phone. And their internet is ubiquitous. It's everywhere. They can get on Google pretty much anywhere and look up anything. And a lot of places don't have any filters that limit websites and things like that for children. So, this idea of children knowing and understanding their digital footprint, they teach this in most schools now about digital literacy, but there's physical and legal dangers of their online behavior. So I think one of the biggest things you can share with your kids is that if you post or text anything, it can be there forever. Even if it's it's just there and then it disappears. It's a snap and then it's gone, or whatever the latest app does. No, you can screenshot things. You can record, audio or record on your phone. Like there's so many ways that it can be dangerous, and you should assume that it will never remain private. Even if someone promises they won't share or promises this or no, assume it will not remain private. Tell your teens not to post or text something that they wouldn't want everyone to know, including their teachers, the principal, their parents, their grandparents, potentially their religious leaders. Just if you wouldn't share it with everyone, don't share it at all. If it's not appropriate, don't post it, don't text it. And especially for anything of a sexual-rated content, stop, think, and before you text or post online. I think other important things to share is, checking your child's privacy online for their social media. So for my kids, they can't allow friends of friends to join their social networks. They can't let anyone join their social network. It has to be someone they physically know that they spend time with, that is their friend. I don't allow them to let other people, message them like, hey, I'm a friend of so-and-so and I want to be on your network. That's absolutely inappropriate. And that's how predators and things can get into children. I also tell them just again about just other safety measures. You don't post about where you live, your address, your age, your phone number. If someone's asking for that and you don't know them, you don't share the information, and you tell an adult if that's happening. You don't meet someone that you don't know, even if they say they have something important for you, or some friend said this or that, you don't. And then a note about, search engines and filters. They're not 100% effective, and assume that your teen has Googled most every question anyway. And as we all know, we've all done this, right? On the internet, you Google something and then you go down this rabbit hole that leads to one thing to the next thing to the next thing. So you can start with something very innocent and then you lead to a pornography website. It's not hard to do. So these, pornography can lead kids feeling very weird, ashamed, scared, confused.
Yes.
As we know, it portrays an inaccurate form of sex. It's the movies. It's role playing. It's not. It's usually geared for male pleasure. It's not how we want to give them their sex education. But unfortunately, that's how a lot of kids get it, because if you don't have the conversation, they look for it elsewhere. And what's on the internet is a plethora of websites for pornography. I'll just share one time with my kids that we were searching up cockroach, and let me tell you, it went awry. So just be careful. Just be careful what you type in Google, and make sure you're typing the full thing out, because some words are blocked, but if you hit enter, sometimes other things will pop up. So just know that even though some sites are blocked, they can become open depending what you put in there. And then just one final note about sexting. It's with phones being at everyone's fingertips, and
Yes.
for teens, it's their primary form of communication. They want to share. They want to share just if they were talking. But when you're talking, that form of information doesn't get then shared and reshared and resnapped and all these other things that can happen with a phone and digital online conversations. So just reiterate that as soon as it's on there, it's instantly shareable. And be the person your teen trusts to bring sensitive topics to, because you welcome the conversation, you give them permission to talk about the topics, and then you're not scared, shocked, embarrassed, frightened, that although you may look that way inside, put your poker face on and do the hard thing and have these conversations with your teens.
Mm-hmm.
So, Dr. Iglesia, how can you use social media to provide teachable events?
Yeah, I mean, I do. I think that a lot of people are getting their information from the internet, social media, images. It's galore. I think a separate topic that we should probably at some point talk about are the dating apps. And this isn't even because you have to be 18 and older, but the images on, Tinder, Grindr, Photoshop stuff. That's a separate thing to talk about. But let's just talk, since this segment is about teens, we need to get information that's reliable. So there are some great things like, I remember ACOG's campaign on Instagram talking about the hymen and how presence or absence of a hymen will not ensure virginity. And I thought that was great, so that, all this information and even people's desires for hymenoplasties to be a virgin again, that's an important thing. I think everything with the Patty Brisbane Foundation is important. However, I had this conversation recently with one of our medical students about the disinformation or misinformation on a lot of websites, including TikTok, and particularly misinformation about contraception and how IUDs work and how they're going to make it infertile, I that is the kind of stuff that, gosh, I wish there was a way that this could be vetted so that when it's not, I mean, clearly we're not doing a great job because this information is just goes viral sometimes. In addition to that, I think images and situations related to dating violence, I mean, that's a definite problem, on social media. So I would say, again, tell our teens and stuff, trust your gut on this, and don't feel pressure, and question, because not everything that's on TikTok is actually accurate.
So having those conversations with your teens, you might be seeing this on the internet, and again, coming to me and having this conversation. So what you're saying is maybe if they see something that they're not sure of, to bring that conversation to you, so then you can openly discuss it and have the poker face on when they do that, right? Yeah. Because they're
I'm actually shocked sometimes because we have all these millennials and Gen X's and Gen Y's that we hang out with, students and undergrads who are doing research with us, and they show me this stuff, and I'm like, oh my gosh, and it's really a disservice. So, that's why I admire you, Patty, and that we're doing these kinds of things that kind of are legitimate, but it's just an area for abuse, and it's an area that, when it comes to sexuality and the shame and misinformation that's out there is unfortunately pretty high.
Well, that's why we're having this conversation, is because so we're going to break that chain. We're going to start that. And because I think it's so important that we're doing what we're doing.
Yeah.
Speaking of which, Dr. Vaccaro, how do you make sure that you don't make assumptions about gender identity and sexual orientation?
Yeah, I love this question, and I love this conversation as well. So I think maybe just starting with some definitions, just because we haven't touched on that yet. So just first, gender, what is it? And, at birth, babies are assigned a male or female gender based on their external genitalia. And this sometimes is also just referred to as their sex. And most children's identity or gender aligns with what their feelings are, aligns with their sex, but sometimes it doesn't align, meaning that sometimes a baby that's born male identifies as female and thus would be transgender. So gender identity is more about the thoughts and the feelings a person has, which actually I was surprised to learn starts really young. So like as early as 3 to 5 years old is when young children start to identify as a certain gender. And then the other definition is sexual orientation, which I think these terms sometimes get intermixed and used interchangeably, and they're very different. So sexual orientation refers to the gender you're attracted to. So if you're female and you're sexually attracted to males, that's a heterosexual orientation, which is still, more than 90% of our population identify as heterosexual. If you're a female and you're sexually attracted to females, this is a homosexual orientation, often called lesbian. So this whole idea of gender identity could be a whole nother podcast, I think. But as it applies to teens, I think what they need to know is that there's lots of different sexual orientations, and even though the majority of people are heterosexual, about now 5% or more, that the surveys keep changing, are identified differently than heterosexual. So again, approximately 5% of the population is LGBTQIA+, and most people are likely to know someone that has a gender orientation that identifies like this, and that is actually great because it normalizes it and it welcomes that personal expression of sexual orientation. So then just to answer your question about why it's important to talk to teens, as we might assume, like for my daughter, that she's going to have a boyfriend in the traditional manner. So if I ask her constantly about, hey, do you have a boyfriend? Do you have a boyfriend? How's your boy? How's that guy that you talked about, this and that? it tells her that that's the only appropriate path that I'm going to talk about. And I'm not going to open the door to other genders that she may be attracted to. So, of course, this takes a lot of thinking. And for us, as parents, kind of reformulating the question and making sure we're being inclusive. So self-awareness is probably the first thing that parents can do about making sure that we're being open with our child's sexual expression and sexual orientation, and giving them permission that any sexual orientation they choose is okay. And it's actually really critical for them to know that it's okay for healthy sexual development and mental health as well, because we know if we suppress a normal expression of gender identity or sexual orientation, that leads to mental health disorders because of the mismatch. So you're only doing your child a service by being open to let them explore their sexuality in a way that feels natural to them. So I'll stop there.
That's a great point, just because I think we're all guilty assuming it's going to be a heterosexual relationship. And are you thinking about, I just had the conversation with Max the other day, my grandson, you like girls now? Yeah. And you took me right there, and I probably shouldn't have assumed. And so I think thank you for that great reminder. And I think all of us need that. And
I need it too. Because it's hardwired. But, sometimes asking, who are you hanging out with at school, or, who's your best friend at school, and why do you like them? And,
yeah,
and trying not to assign male or female roles to it.
There you go. Dr. Iglesia, what are some of the classic styles of conversation? For example, active listening, let them lead the conversation.
Mm-hmm. Okay, well, it's classic, probably not just in parenting and talking to your teens about sex. It's actually even classic with doctor-patient relationships, because it's mm-hmm. We have a tendency to cut patients off on like 9 seconds or something, assuming that we want to just cut to the chase. So active listening to me involves listening with empathy, particularly these topics when you're talking about sex, mm-hmm. but mirroring what they're saying. So, so what you're telling me is that your friend, blah, 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 and a lot of times it'll be about a friend, not them, my friend, so-and-so. I think and then another thing to say is that it sounds like this, or tell me more about that. What does that mean to you? What was that like for you? These kinds of open-ended questions are the ones that encourage further discussion, as opposed to saying, you did that? You're thinking about what? With who? Or the other thing I think that resonates is to even talk about yourself when you were the awkward teen, your own personal stories about how you like Ted or whatever, and you circled as anything that had the word Ted in it, or something. I think understanding that and just kind of humanizing yourself and not interrupting and asking about their feelings, and then thanking them for sharing. I mean, I do that a lot for patients that I know that we've garnered a lot of trust, and they tell me things, and they always say that you're the first person I've ever told that to, Dr. Iglesia. And I say, thank you for sharing, because that was, they didn't have to tell me all this, but it certainly does helps me understand you as a patient and your goals and your expectations and where you're coming from. So I think you can be very similar, I think, with teenagers.
There you go. Absolutely. Dr. Vaccaro, how do you keep the door open for future conversations?
Yeah, Patty, and I'm just going to echo again, Dr. Iglesia, thanking people for sharing information that's very sensitive. I think that's critically important. As I've sort of shared a little bit with my kids, I like frequent check-ins. Again, asking about all aspects of their life, right? Because that's what we do we ask about their life, but also making sure we're including the sexual health aspects. So ask about their day, explore. And then when things come up organically in conversation, like just the other day, my daughter was talking about one of her friends that was had some inappropriate touching at school. That just opened the door to explore that a little bit more in a natural kind of flow, instead of having to schedule something, which sometimes you have to do. But try to capitalize on those conversations that can open the door to other very important sexual health topics. And for my 12-year-old, these are becoming increasingly frequent conversations, because things are changing quite rapidly at this point. And like we've also sort of talked about, just that poker face, being non-judgmental, always being loving and welcoming, telling them no matter what they do and say, you're not going to judge them, you're always going to love them, they're in a safe space, and giving them permission to talk openly about their feelings and their curiosities, because they're going to have a lot of questions. So just maintain that open door with your kids and frequent check-ins.
There you go. And I think everything that both of you have said today is so important. And again, it's that trust, and especially the poker face is so important, not to be shocked. So they know that they can come back to you at any given time, and you're still going to be there for them. So right now I want to thank my guests, Dr. Christine Vaccaro and Dr. Cheryl Iglesia, for a great conversation. And if you like what you heard today, please rate and subscribe to our podcast. For more information on the Patty Brisbane Foundation for Women's Sexual Health and our 6 focus areas, visit thepattybrisbanefoundation.org. Remember, sex care is self-care, and sexual health matters.